At UC San Diego, we strive to perform groundbreaking research and provide inspired teaching. As the only academic medical center in the region, we're also committed to delivering the highest standard of clinical care to our patients. This includes patients with one of the most dangerous clinical conditions, severe sepsis.
Sepsis is deadly. That's why our Code Sepsis project is so important. Severe sepsis, sepsis with organ dysfunction or low blood pressure, is as deadly as an ST elevation heart attack.
That's right, Chad. Sepsis is as dangerous as a STEMI, but currently only half the patients get all the tests and treatments they need. Early recognition of sepsis is crucial. The Systemic Inflammatory Response Syndrome, or SIRS, means that the patient has two or more of the following: low or high temperature, high heart rate, high respiratory rate, and low or high white blood cell count. SIRS plus infection is sepsis, and if the sepsis causes organ dysfunction, it's severe sepsis. That means any of the following. Septic shock is present when there's hypotension after fluids or a lactate greater than 4.
These rules are hard to remember, but they're always at your fingertips because they're listed right here in the sepsis order set. Use it.
But rapidly providing sepsis tests and treatments lowers the risks and saves lives. So how do we manage sepsis? Blood cultures and other studies can identify the cause of the infection. Checking a lactate can identify patients who are sicker than they look. Immediately giving antibiotics after culture is strongly associated with better outcomes, including survival. And IV fluid maintains blood flow to vital organs, preventing a spiral of organ dysfunction. Within 3 to 4 hours, make sure the lactate has been rechecked, pressors are started if needed, and all patients with shock are reassessed using the sepsis reassessment note template to make sure nothing is forgotten.
These interventions are hard to remember too, but they're always at your fingertips because they're listed right here in the sepsis order set. Use it.
Unfortunately, we're not using the Code Sepsis team as much as we should. Teams are thinking they remembered everything when they haven't. So call the code. Call extension 6111 if your patient has SIRS and suspicion of infection. The code nurse will bring a checklist which helps us remember all the important steps.
To review, get the blood cultures and lactate, recheck if it's greater than 2, give antibiotic stat, give fluids if appropriate. If the lactate is greater than 4 or there's hypotension after fluids, that's shock. Give a 30 milligram per kilogram bolus, start pressors as needed, and do the reassessment exam using the sepsis reassessment note. Of course, if one or more steps isn't right for your patient, don't do it. Don't follow the protocol blindly. Just document that the clinical findings are not due to sepsis or why the intervention isn't appropriate.
Remember, to slay sepsis, the most important step is to call the code.
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 Call the code.